I'm Adam Olszewski. I'm an associate professor of medicine at Brown University and a clinical hematologist at Rhode Island Hospital. And I will talk to you briefly about the results of our phase 1/2 clinical trial of mosunetuzumab, a new bispecific antibody, as a first-line treatment for elderly and unfit patients with diffuse large B-cell lymphoma. The population of elderly and unfit patients with diffuse large B-cell lymphoma is a difficult one to treat. These patients often are not able to receive full-strength standard curative immunotherapy, and physicians prescribe attenuated regimens, which are still associated with toxicity and lower rates of long-term progression-free survival than full-strength regimens. In this study, we enrolled patients who are unfit to receive full-strength chemoimmunotherapy by virtue of their age, 8 years or over, or age 60 to 80, with an additional functional impairment, impairment in activities of daily living, impairment of instrumental activities of daily living, or medical comorbidities. These patients received no chemotherapy at all. They received immunotherapy with mosunetuzumab, a novel bispecific antibody which engages B cells through CD20 and T cells through CD3 and causes immune effector attack against the lymphoma. The toxicity of this regimen was actually fairly low in this elderly and frail population, with only about 20% of patients having CRS, and in almost all cases this was cytokine release syndrome grade 1, with only one case of grade 2 CRS. And there was only one concurrent case of grade 2 neurotoxicity. There was no high grades, grade 3 or 4, either neurotoxicity or CRS observed in this study. Otherwise, the treatment was quite well tolerated. Most patients just came for their infusions without any major problems. And approximately 63% of them so far have achieved a response, with about 45% achieving complete response at the end of 8 cycles of chemotherapy or immunotherapy, which is a significant achievement since these patients had no exposure to cytotoxic chemotherapy at all. This is obviously an early experience. These patients continue to follow up. The current follow-up is only, current median follow-up is only 5 months, but so far all patients who achieved a complete response have sustained it. And the patients who have been longest on the study have now sustained it for over a year from achieving complete response. If these results are confirmed and sustained, this would be a novel option of treatment for patients who are poor candidates for chemoimmunotherapy, and which potentially could provide a curative option for these patients.